Today, we live in a deeply interconnected world. What happens in one country can influence the life of millions of people on the other side of the planet. In this context, the concept of global health emerges as a field of study that arises in response to the growing interdependence among nations and the effects that globalization has on human life, focusing especially on the health and well-being of nations. Over the past decades, global processes have intensified social, economic, and environmental relationships beyond national borders. This has changed the way health risks and benefits are distributed. Although the world has achieved significant advances, such as the increase in a global life expectancy from 61 to 67 years, these improvements have not occurred equally. Large inequalities still exist between countries and among different social groups. Global health became established as a field of study in the late 1990s, with the aim of replacing traditional international health models with approaches that are more just, collaborative, and capable of responding to threats that affect all of humanity. Problems such as pandemics, climate change, economic inequality, and population mobility have shown that the health of any region can quickly become a global concern. The purpose of understanding global health is to explain what this concept means, what its foundations are, what its current challenges are, and why it has such strong social relevance in the contemporary world. To analyze this topic, a documentary review based on specialized academic literature was conducted. Scientific texts and articles on globalization, health, and current definition of global health were studied. From this source, central ideas were identified and the information was synthesized to clearly explain the principles, dimensions, and challenges of this field. The results show that global health is currently understood as both an academic and practical domain whose objective is to improve and protect, in an equitable way, the health of population and also that of the planet. This approach recognizes that health does not depend on a single factor, but on a multiple interconnected elements such as social, economic, and political systems, as well as global challenges like pandemics and climate change. The dimension of people focus on the well-being of populations. It considers factors such as nutrition, access to medical service, education, mental health, and living conditions. The dimension of the planet recognizes that human health is deeply connected to the environment, climate change, air and water pollution. Biodiversity loss and natural disasters directly influence the emergence of disease and quality of life. Finally, the dimension of policy and practice address the decision strategies and concrete actions that governments, organizations, and professionals implement to improve health. It includes health laws, prevention programs, international cooperation, and healthcare systems. Without adequate policy, even the best scientific knowledge does not translate into real improvements for populations. In addition, globalization has been shown to produce dual effects. On one hand, it can drive medical and health progress. On the other, it can also increase inequalities and risks for vulnerable populations. In conclusion, global health is a multidisciplinary and action-oriented field that seeks to respond to the health problems that do not recognize borders. Its importance lies in integrating scientific knowledge, public policy, and international cooperation to face shared threats. This approach provides a broad perspective that recognizes that human health also depends on environmental balance, social justice, and collaboration among countries. The recent pandemic made it clear that all nations are interconnected and share vulnerabilities, confirming the need to strengthen global organization in health matters. In summary, global health is a fundamental tool for understanding today's world and for building collective solutions that promote well-being, equity, and sustainability for all humanity.